Human Services is the heart of government that provides individual services and programs to the most vulnerable residents in our community. Human Services provides a lot of essential services to vulnerable populations. In our department, we provide services to older adults, people with physical disabilities, and low-income residents. And our mission is basically to keep them in their homes with dignity and promote self-sufficiency. One of the biggest roles in human services is actually social work, both on if you want to work with the older population or you want to work with low-income residents. Social workers are used to go into the homes, determine what types of services or needs are available for older adults or people with disabilities, whether it's rent assistance, utility assistance, employment, food pantry, or any of those type needs. I would say one of the lesser known facts about human services is that a lot of people are just one emergency away from needing our services. And so when you think of human services and you think of poverty and who we're serving, it's not what you always picture in your mind. A lot of times we do prefer an advanced degree, so some type of either associate's degree or a bachelor's degree, especially if you are going into a social worker case management role. But some of our frontline staff, they just have a high school diploma or again, like an associate's degree. You can kind of work your way up, and sometimes you kind of figure out in government that a lot of degrees can substitute if you have the experience.
So generally in mental health, you'll find a clinician, which is a master's level professional in either social work or professional counseling, marriage and family therapy, or psychology. The other position would be a case manager, which is a bachelor's level professional. Honestly, seeing the recovery in people is the most rewarding part. Sometimes people come to us with a wide range of sort of issues, ranging from homelessness to needing their basic needs to mental health. So sometimes they're coming to us, we're in a really difficult spot, so being able to support them, guide them through that process, help them get connected to resources is sort of magical to see them on the other end and get to graduate people. Like, that's the best part. I am naturally sort of a passionate person. I enjoy helping other people. I kind of thought that I would do psychology, and then as a part of going to college, I figured out that social work was more for me because it really allows you to be in the middle of everything, which fits well with me. I like to help other people and sort of support them and definitely be able to sort of walk alongside with them.
I think one of the most surprising parts about public health is how a lot of people didn't know about public health prior to the pandemic. I guess the thought was that a lot of the things that we do was kind of in the shadows, and it wasn't to the forefront until the pandemic started and started like actually affecting kind of the day-to-day lives of certain people. Public health is so critical because it is literally everything that we do involves public health. Whether we're driving down the street, if we're going to a restaurant, if we're even talking about housing and things like that, like it all involves public health. Typically we're supposed to figure out where we see any increase in disease in our county and respond to it accordingly. As of recently, as everyone knows, we're in a pandemic, so the disease of choice, I guess, would be COVID-19. So we're trying our very hard to respond to that as best as possible, getting people aware about COVID-19, about the vaccines, doing everything we can to prevent any new infections. And so the type of skills and characteristics that someone could have to do well in public health is they need to be adaptable. They need to be able to adjust to any situation. Be team-oriented. A lot of the things that we do involves other departments, other stakeholders, other partners, and you also have to be very into people and helping people. It's very fulfilling. It's a very fulfilling work. If that's what you're looking for, if that's a position that you're looking for to impact someone's life, to if you're interested in equity and fairness and getting certain healthcare resources or other resources to the community, then this is definitely going to be the job for you because it's filled with purpose. It's very, very meaningful.
So there'll never be a shortage of people. There'll never be a shortage of people who need help and support and resources. And mental health is something that everybody struggles with, no matter where you come from, what you look like. So we definitely need more people to want to do the work that we do so that we can keep meeting the need for the community.
I would say someone who has empathy, that they have compassion, because again, you're dealing with people. So you want to have someone who really cares about the job. This isn't a job that you come to and it's just a job and you could go home 8 to 5. This is a job that you're putting your heart into.